The essence of an IVF cycle is to achieve a healthy singleton pregnancy which delivers at term. It sounds easy, but actually it is not so easy, especially for couples who are actually finding it difficult to get pregnant or stay pregnant. What could be the hurdles? The egg quality or the sperm quality may not be good enough for them to have a pregnancy. In most cases, we also can't do much about it. At best, we can inject and make more than one egg grow up. At best, we could combine the egg and the sperm together in the lab to form multiple embryos and then allow them to grow in the lab to see which of them is looking good. And sometimes we do end up with multiple embryos which are growing well and looking good. But believe me, even if they are growing well and even if they are looking good, only a few of those are healthy enough to give us a pregnancy. And in couples who are interested in getting pregnant fast and staying pregnant and delivering a healthy baby, they are bound to ask questions. Doctor, if your current method does not help us to select the right embryo, then what extra can you do for us? One of the extra things that we can do for couples is to do a PGT-A of the embryos. A PGT-A stands for Pre-implantation Genetic Testing for Aneuploidy in the embryos. What is aneuploidy? See, all human cells have 46 chromosomes, all healthy human cells. But all sperms and all eggs do not have 23 chromosomes. Some of them may have less than 23 and some of them may have more than 23. When the egg and the sperms combine, they do not make up 46 chromosomes. They might make up lesser than 46 or more than 46 chromosomes. And that's not good because nature does not allow these kind of embryos to continue or at least become a healthy embryo. So, by looking at these embryos, we are not in a position to tell you whether it's a healthy embryo or not. We need to take out cells from these embryos, analyze the DNA of those cells which you have extracted from these embryos, look for the number of chromosomes present in those DNA, and then come back and tell you whether these are actually containing 46 chromosomes or less or more. And that test is known as a pre-implantation genetic testing for aneuploidy. Yes, so all couples essentially qualify for a PGT of the embryos so that they can choose the right embryo to be implanted in their womb. But life is not so simple. The law does not allow us to do a PGT-A for all embryos. Very simple. It's very expensive, the technology is not robust, and you could have an abuse of this technology as well. So, for now, a PGT of embryos is limited to couples who had multiple miscarriages in the past, or if they have a disease in the family which is linked to a genetic condition. In those circumstances, a PGT-A or a PGT-M of the embryos will help them choose their embryos properly and then get pregnant with hopefully a healthy pregnancy. For others, a PGT-A may seem to be the right answer, but they have to be satisfied with a standard IVF cycle unless they have failed cycles, and then they may qualify for an advanced technique such as PGT-A to help them get pregnant.